Hi, and welcome to our webinar on remote patient monitoring in 2022. My name is Chelsea Grover, and I'm the Marketing Manager at DAS Health. Before we get started on today's webinar, I want to take a moment to explain the process for the presentation. First, I'd like to mention this webinar will be recorded, and it will send out a copy of the slides along with the recording within the next week. At the end of the presentation, we'll open the floor up to questions from you. We'll answer all the questions at the end, but you can type them in the questions area of the webinar control panel whenever they occur to you. And finally, for audio clarity purposes, everyone's phone will remain muted throughout the entire webinar. If you experience audio issues, please use the chat box to let us know so we can resolve them. And again, questions may be entered in the questions box. So without further delay, I'd like to introduce our presenters for today. Lindsay Lanning is our Client Development Manager and Melissa Combs is our Engagement Manager at DAS Health. They're both super excited to share their knowledge with you today. So with that, I'm going to let them get started. Lindsay, it's all yours. Feel free to get started when you're ready.
Great. Well, thank you, Chelsea, and thank you everyone for joining our webinar today on remote patient monitoring, or RPM. So as we all know, remote patient monitoring programs, technologies, and even the protocols are becoming increasingly popular due to the benefits they can offer your patients, your providers, and even your practice's bottom line. And that is what I like to call a win-win-win. So as we know, RPM uses technology to go ahead and collect and also send patient-generated data to clinicians or their care team, who treat and actually provide care to those patients for both chronic and acute conditions. With this type of real-time data at your clinical care team's fingertips, naturally, remote monitoring is going to facilitate better clinical outcomes, which is why we wanted to host this webinar. So your practice is aware of this opportunity and could take advantage of it. So our goal is to provide an overview of things like federal policy, the current reimbursement landscape, as well as best practices to launch your own RPM strategy in 2022. So we're going to explore the essentials to what really makes up a successful RPM rollout, as well as the benefits of RPM that many may not realize, such as using this service not only to help your patients, but also to combat physician burnout in your own practice. So just to provide an overview of what we're going to cover today, don't want to throw any surprises at you, here's what's on the agenda. So we're going to provide a very, very brief overview of what RPM actually is and explore how it works in real life. We're then going to look at the why, why RPM is so popular right now and why it's helping providers as much as it is helping patients at this point in time. We're also going to provide, again, an overview of reimbursement, what's required, how to bill for it, and what kind of return you could see after implementing this service. And then finally, we'll look at how you would actually roll out this program and how DAS is here to help you if you'd like. Basically, our goal is to look at the clinical and financial benefits of RPM and answer some of the key questions I'm sure all of you have. Think of things like who can order, provide, or even bill for RPM. Which patients are even eligible for RPM? What are the requirements for coding? What types of devices are currently being used for RPM? And most importantly, how do we start using remote patient monitoring right now? So let's just go ahead and kind of jump right in here. So first and foremost, we're going to start with the basics. What is remote patient monitoring? Well, in its simplest form, RPM is going to involve the use of connected electronic tools to record some form of personal or medical health data in one location that's then going to be reviewed by a clinician or their care team at a different location. That data may or may not be viewed as soon as it's transmitted, aka live, or after the fact. But basically, if you were describing this to someone, you would want to say it uses some sort of IT to collect and send patient-generated health data to providers who can in turn provide care to patients more efficiently. So what this all means is one very important thing. RPM allows healthcare providers to monitor patients outside the clinical setting. This is significant for both chronic care disease management as well as improving healthcare access. So this type of monitoring has proven to encourage patients to better participate in their own care and really take better control of their own health. And you can see based on the graphic how RPM has actually slashed hospitalization readmissions for heart failure and COPD in a pretty short amount of time. Now, you may be asking what conditions or patient populations can RPM serve in your own practice? And I think most of us tend to default to chronic conditions. And to be fair, it is used, most often to monitor chronic conditions. However, you can use this service and get reimbursed for an acute condition as well. So I will say it again because it's oftentimes overlooked. RPM can be used to treat both chronic and acute conditions. This enables clinicians to keep tabs on patients in between clinic visits or when in-person care just is not possible. And we're seeing increasingly that health systems are leveraging RPM to care for patients suffering from a myriad of conditions. So some of these you're going to see on your screen. They include obesity. Maybe your RPM device is a scale to track weight gain or loss. Hypertension. The RPM device would likely be a blood pressure cuff. COPD. The patient could maybe have a pulse oximeter at home that would send data back to your office. Diabetes. We've seen some sort of blood glucose device that transfers data to your office regularly. And then most recently, we've seen certain devices and RPM functionality related to COVID-19. So these are all instances where an RPM device could benefit the patient and improve their care. Now, one distinction I think is very important to make before we go any farther here is the difference between RPM and telehealth, as well as RPM and CCM, or chronic care management. So telehealth mainly involves the use of electronic information and telecommunication technologies, right? Think e-visits. While RPM does pair very nicely with telehealth when patients need to be monitored for certain health conditions, for instance, if a patient had a blood pressure reading out of normal range using their RPM blood pressure cuff device, the provider could then use that information as a reason to set up a telehealth visit that same day to figure out what's going on. A key difference on the reimbursement side of the house between these two is, looking at Medicare specifically. Medicare covered telehealth services, and again, this is pre and possibly post-pandemic, typically must meet originating site or geographic restrictions, and services are actually paid for as if they were furnished during an in-person encounter. Whereas Medicare covered RPM services have none of those originating site or geographic restrictions, COVID or not, and the services are paid separately from an in-person visit. Now, CCM, or again, chronic care management, it is a very similar service to RPM. They look a lot alike. However, there are some key differences. So CCM involves care coordination outside of regular visits, and it really differs from RPM in terms of two things: patient eligibility and reporting requirements. So CCM actually requires patients to have 2 or more chronic conditions lasting longer than a year. So remember, you only have to have one acute or chronic condition to be eligible for RPM. Also with CCM, patient monitoring times range from 20 to 60 minutes per month, and 24/7 access must be provided. So CCM is a little bit more stringent on their requirements versus RPM. So now that you know the basics of RPM here, we're all at the same foundation, you might be asking why. What are the major benefits to doing this versus seeing my patients in person more often? So here are some benefits RPM can offer that we want to highlight. And if maybe you're already sold on this idea of implementing RPM, heck, that's why you joined the webinar. But keep in mind, you may still need to gain buy-in from others in your practice. So here are some areas that we recommend focusing on. For chronic care in particular, RPM is going to enable clinicians to observe patients in near real time, gather that necessary data, and make adjustments to improve their care outcomes. This type of continuous tracking is helpful for patients with ongoing care needs. Think of the conditions that we've already mentioned: diabetes or heart conditions, hypertension, but think of some of the other ones that we haven't mentioned, like asthma or even mental illness. And I know I mentioned COVID-19 in the past, but more recently what we're terming long COVID, the long-lasting symptoms following COVID-19 infection and recovery. Now, this may seem very obvious, but again, it can lead to many positives here. RPM is going to allow that consistent monitoring of that physiological data. This can increase the speed of achieving certain treatment goals. It's going to allow for real-time opportunities for intervention by treating readings outside of the patient's normal measurement limits, which also, if you think about it, you're getting a much more real view of the patient. Speaking from personal experience here, of me at the doctor's office a month ago, I had to get my blood drawn. I hate getting my blood drawn. So when they took my blood pressure, not once, not twice, but 3 times, it was sky high. And that obviously, wasn't the norm for me. So when you're getting your patient's vitals in their home, you're much more likely to get accurate results that aren't impacted by some of those external forces, such as maybe the stress of coming into the office for whatever reason. Maybe they also hate getting their blood drawn or needles in general. Or maybe there was bad traffic on the way in, there's some residual road rage there, or maybe parking was a mess. All of these types of external stressors are removed in this scenario. Also, with constant monitoring, there's the ability to view and assess data trends over periods of time to make much more informed decisions for patients. And let's also not forget the increased number of touch points RPM offers, which really allows for more opportunities to address other health needs of a patient. Think like medication adherence, checking in on that. But also increase the overall patient engagement and either improve or deepen that patient's relationship with your practice, while all at the same time increasing your practice's revenue by being reimbursed for this service. So if I had to pick, a quick, concise outline of reasons to choose RPM, it would look something like this. Sometimes, what we've seen is that you may have upper management or clinicians who want the Spark Notes version, of why we want RPM. Here it is. Here's what I would include in your 30-second elevator speech to them. One, it's going to improve patient outcomes. Automated triage allows patients to alleviate symptoms. It encourages care plan compliance, and it lets clinical staff know when intervention is needed. It can increase patient engagement. Also keeping in mind, it can boost team capacity. Accurate data saves time, it improves documentation accuracy, and it leads to more effective management of health in general. It also is going to automate some non-critical care-related tasks, which can allow for organizations to really refocus those resources maybe on some other priority patients or issues where they're needed most. And lastly, it's going to lower overall healthcare costs while also increasing your practice's revenue. This should lower the overall cost per beneficiary and at the same time create that additional revenue stream from the reimbursement options we're actually going to touch on here in a second. And if that doesn't work, I would start sharing some of these impressive statistics, which I won't read through, but you can see them here in the blue bubbles on the screen. But it'll be good to have in your back pocket when we send out a copy of the slides as well, and kind of your argument for RPM in your own practice. Now, there is one huge reason or why missing from that list that I would say is one of, if not the most important reason for adopting RPM right now, and that is combating provider burnout during this pandemic. I am well aware I am the last person you need to hear from on this topic. You all are on the front lines and have experienced firsthand staff shortages, provider burnout, staff burnout, reluctance of patients to even come in and see you. Just an overall sense of overload and overwhelming of the entire system. So while remote patient monitoring is by no means a new care modality, it is evolving rapidly, specifically being spurred on by the COVID-19 pandemic for these reasons. Prior to the pandemic, RPM tools were becoming more and more common. We had seen things like blood pressure cuffs and even blood glucose monitors. There was actually a survey done by the American Medical Association that showed the number of physicians actually launching an RPM program, and it actually doubled between 2018 to 2020 from roughly 10% to 20%. Since it was all the way through 2020, we can attribute some of that dramatic growth to potentially the need to care for COVID-19 patients at home during the pandemic, but that shift was happening prior to this as well. Also with the COVID pandemic, hospital emergency rooms and beds were at capacity, but also, provider rooms as well inside your practice. And alternative ways of access to ongoing daily care were and still are needed. So cue kind of RPM fitting this mold. It's designed to prevent readmissions through proactive measurements, and it's played a huge role in the pandemic to perform remote monitoring and prevent patients from even returning to high-risk public spaces. We've seen several health systems and practices nationwide that have even developed and implemented RPM platforms of their own in response to the pandemic that focus on monitoring patients with COVID-19 after hospital discharge. Now, specifically the roles we see RPM serving most, right now within the midst of this pandemic are: one, allowing busy staff to focus on multiple patients constantly. Imagine providers or your care team can regularly track a wealth of vital signs from inside a patient's home, which removes the burden of frequently traveling to a clinic or a hospital or your practice on the patient side of the house. And it's also going to still collect that vital data and send it to secure dashboards that will provide alerts and guidance for your team to prioritize which cases need attention or what patients they may need to see in person. It also, again, I touched on, allows patients to remain in their home and be monitored and not risk exposure or further spread of the virus. It's convenient. It's a convenient health data solution. It's going to enable social distancing and at the same time reduce that administrative workload on you. RPM can also enable physicians to discharge patients early and monitor them remotely after leaving the hospital or your practice, freeing up those rooms, while still providing the sense of reinsurance to go home. Again, in the COVID-19 example, maybe with a pulse oximeter that they know a clinical care team member can monitor and track. On the flip side, using RPM to monitor symptomatic patients pre-admission or pre-exposure to your office to know when things get too serious to stay at home. And this, again, is not just for COVID-19, but really any condition that your practice sees. But by far the most critical role RPM has played is to alleviate provider burnout. The National Institute of Health actually reported that approximately 1 in 3 physicians are experiencing burnout at any given time. And while COVID has certainly put a spotlight on this topic, it is an issue that existed before the pandemic, and it's not going away. There are many factors that contribute to burnout. Some of the main ones that we've seen being long hours due to potential inefficiencies in the work environment. Dare I say out loud, electronic health record stressors, the documentation requirements, the clicks, we've seen it. Potentially poor work-home balance because of those requirements. A higher volume of patients, but not just regular patients, but very, very complex patients. And also a high percentage of canceled appointments or patient no-shows. Now, according to the Physicians Foundation, as of September in 2020, 58% of physicians said they had feelings of burnout, compared to the 40% in 2018. So again, we know COVID had a huge impact on this issue, and a lot of providers expressed, maybe fears of contracting COVID and taking it home, and then, in turn, social isolation and overall lack of resources, but also providers. We saw so many leave the field over the past 2 years due to burnout, patient overload, but also on the flip side, patient no-shows. It's stressful knowing you have patients who have conditions that need to be treated, but they aren't coming in to be seen because of fear. We know that burnout is associated with, increased negative clinical outcomes, a potentially decreased quality of patient care, an increased number of medical errors, and even higher rates of addiction, depression, or suicide among physicians. Now, because RPM can keep these chronic and acute conditions out of the emergency department or hospital, or potentially out of your practice for a little bit longer, and keep your staff stressed to a minimum when they're able to monitor multiple patients from afar, it is able to reduce the stress of overbooked, physical in-person appointments while assisting more patients per day using RPM, which hopefully can result in higher job satisfaction and lowered stress, which is absolutely the goal right now. So I hope you realize now is the time to consider implementing this in your own practice. We're seeing firsthand how COVID-19 has allowed RPM to gain substantial buy-in, both from providers, even from patient populations that may have been skeptical years ago. We're also seeing this trend with payers, Medicare, but also state Medicaid programs and private payers as well. So I will apologize. I know that introduction was probably a bit lengthy, but I think our why for wanting to put this webinar on, and a huge why for the industry as a whole right now, is the priority. And the fact that RPM can address so many of these issues is why we're so passionate about it. Now, some of you, aka all of you, are likely curious on how RPM can actually improve your bottom line and the overall financial health of your practice. So I'm going to hand it over to Melissa to take us through how to bill and how to get reimbursed for RPM from Medicare primarily, but because they typically set the standard, but also look at what state Medicaid programs offer and even what private payers are looking to do as well. So Melissa, it is all yours. I will hand it over to you.
Thank you, Lindsay, and good afternoon, everyone. Very excited for the remote patient monitoring service. As you may or may not know, CMS has made significant moves towards value-based care, especially during the COVID pandemic. They are increasing reimbursement for remote patient monitoring, and different than chronic care management where it's Medicare only. There are commercial payers, as Lindsay did mention, and the value-based care through virtual care services has now paved the way for providers to hold patients more accountable for the participation of their care. As Lindsay also mentioned, there are 3 specific goals when we are creating these new billing and revenue opportunities for RPM services, which you see here. Overall, to improve the quality and the coordination of the patient care. We want to make sure we're decreasing those visits, because obviously the more visits to the hospital, the higher the cost overall, not only to the patient, but to the overall healthcare spending. And we want to make sure that the practice sees revenue and can generate revenue from this type of service. So next slide, please. Thank you. So the swift rise in RPM's popularity was supported by numerous regulatory changes and flexibilities enacted during the COVID-19 pandemic. I know Lindsay mentioned this, but over the recent years, CMS has created and amended codes that do allow for remote patient monitoring reimbursement. In response to the COVID-19 pandemic, some of these guidelines were expanded upon. There was some flexibility there as how the care is delivered by allowing practitioners to treat patients via telehealth and remote patient monitoring. So not only, as Lindsay mentioned, not only can you perform chronic care management telehealth services for your patients, but the remote patient monitoring has truly expanded due to COVID. However, if you want to look on the bright side, if there is a bright side of COVID-19, we have been able to expand these services and truly see some increase in the reimbursement and the care these patients are being given. Next slide. So several billing codes to allow for the cost of procuring the devices are included with these RPM billing services. The devices are used to obviously analyze the data, communicating and documenting the communication with the patient in the care plan, and the codes are reimbursed on a monthly or 30-day period. Remote patient monitoring codes are a little bit different than chronic care management due to the fact that chronic care management works in a calendar month. Remote patient monitoring works on a 30-day period. So a patient can start services for device management on the 1st of the month, the 15th of the month, the 23rd of the month, and we are clocking from that day 30 days forward. So it's a little bit different billing that is done for the patient. However, a care plan is also created for the patient, and that piece of it is billed every 30 days. Next slide, please. There are several codes that are utilized during remote patient monitoring, as you see here. 99453, 99454, 99457, and 99458 are services that are provided not necessarily by the physician, but by a care team. The 99453 code, as you see here, these and the 99454, both of those codes are reimbursed based on the patient providing 16 days of data. So 99453 is a billable one time, the very first time that patient signs up, registers for RPM services, initiates the device, sends readings and sends 16 days of reading. On that 16th day, you're billing the 99453. 99454 and 99457 are billable every single solitary month for the patient. The difference with these two codes is the 99454 is the physiological monitoring of the data, where 16 days of data, again, must be received in order to bill for that service. Your 99457 and your 99458 are the codes utilized for care plan, care coordination, and must include a telephone conversation. It's usually by telephone, but a conversation with the patient in order to bill for those two services. The difference with 99091, you cannot bill that code with 99457 because 99091 is a code that's utilized by the practitioner. So those cannot be billed together. The documentation that for 99453 is the condition is being monitored and medically necessary of the device identified. So if you are monitoring your patient for hypertension, obviously the device being utilized is your blood pressure cuff. Again, 99454 is the data transmission, and 99457 and 458 are the codes utilized when creating the care plan. 99458 is utilized if you're going beyond the 20 minutes of service. Next slide, please. So as we stated, Medicare, the rules are dictated by CMS and Medicare, but we do have, and we have seen the commercial payers such as United Healthcare and Aetna covering remote patient monitoring services, which is a benefit when you think about patients that may only have one condition, or that you may be monitoring an acute condition based on the patient having COVID and they are post-COVID and you're monitoring maybe their pulse ox post-COVID. So very excited to explore that and understand. We actually have seen those policies for those commercial payers. Obviously, Medicare, the commercial payers are following the Medicare guidelines, but at least we know we're moving in the right direction. Next slide. So similar to CCM, the patient may verbally consent for services. The patients need to be an existing patient. However, CMS has allowed some leniency with regards to COVID patients, and they may be monitored post-COVID as a new patient. And also some of the beauty with the monitoring the COVID, you only are required to submit 2 days of data if you are monitoring your patient post-COVID. This could be temporary. However, it's been left open at this time. Some of the other components is the device must be defined as a medical device by the FDA and ordered by a qualified medical professional. So the clinician the patient would have to be part of the practice, and the physician would be ordering the device for the patient. Next slide, please. Some of the guidelines for the devices can be a little tricky. CMS does stipulate that the devices need to meet the FDA's definition of a medical device. The devices must automatically upload patient data. They must be able to collect and transmit the data, so your comprehensive care plans may be created with transparent understanding into the patient's health. CMS does become a little vague on that, but the one thing that's very, very clear is they must be FDA approved devices. Next slide. The devices are used to monitor blood pressure, diabetes, etc. However, remote patient devices may also be used to monitor maternity patients, such as patients that have gestational diabetes or gestational hypertension. We may not think about chronic conditions in that way, so that's why remote patient monitoring allows for those acute conditions, which may be there related to another condition, such as pregnancy. Commercial payers are covering the remote patient monitoring. to make monitoring the health of a patient easier and more convenient for the practice and for the patient. Obviously, we went through some of the RPM device examples that Lindsay touched on, but blood pressure, glucose monitoring, your ECG, your heart rate monitors, smart scales. So scales can be utilized for multiple different reasons. As long as these devices are FDA approved, we are able to utilize them for monitoring your patients. All right, so like I said, CMS does allow some leeway with the COVID patients to be monitored as a new patient, but what's also really nice about RPM is even though we are focused so much more on the private practice industry, your federally qualified health centers and your rural health clinics can also utilize remote patient monitoring. There are a ton of grant opportunities that are available for some of the FQHCs. The other beauty of the FQHC is you can bill similar to your CCM service. There is a specific G code that is billable for RPM services under the federally qualified health center or rural health clinic based on that coordination of care and the care plan being generated for the patients. So it's not just providers standing up for RPM programs. Payers are showing interest in the care modality as well. Last August, United Healthcare launched a new program in Tennessee that will leverage RPM to monitor pregnant individuals. The insurer partnered with the Tennessee Initiative for Perinatal Quality Care to leverage both RPM and connected health programs and train their staff in hospitals across the states. Humana also teamed up with home health provider Dispatch Health to launch an RPM program in Denver and Tacoma, Washington. And this was for the chronic care management patients. There are other payers like Blue Cross Blue Shield that have grants to support the expansion of RPM and the telehealth programs. State and federal governments are also jumping on the RPM bandwagon, with the Department of Veterans Affairs announcing plans to pour $1 billion into an expansion of its RPM program. And the Illinois Department of Aging launching an RPM program in partnership with Advocate Healthcare, OSF Healthcare, and Southern Illinois University of Medicine. There's also 27 states that are reimbursing in their Medicaid programs. There is actually a website that you can see whether your state will reimburse through Medicare. So a lot of good things are coming with RPM. Lindsay, I'm turning it back over to you.
Perfect, great, thank you, Melissa. Well, I think it's safe to say we have definitely already established that RPM uptake among providers has been pretty rapid at this point, particularly after COVID limited in-person care. And as a result, you might find yourself wanting to roll out this RPM program at your own practice. But what we hear most is how. You know, where do we even start with all this information, and what do we do to get the ball rolling here? So I'm not going to lie to you. We have seen firsthand that it can be very difficult to bring this truly in-house and try and roll this out on your own. It is possible, though. I will not deter you. So no matter if you are looking to do this on your own or possibly with the help of a trusted vendor, here is the timeline and kind of overall steps you want to follow. The AMA, American Medical Association, actually recently released a 107-page guide, and yes, I have gone through every page, on how to roll out an RPM program. And this graphic is taken directly from that guide. These are the steps they outline, completely in their whole guide, which again, for them to release that extensive of a guide shows you the importance I think in the industry has on RPM right now. But back to it. So they put identifying a specific need in your practice as the first step for any organization looking to establish this new program. Think any need. Maybe you're identifying a certain patient population that's the need, or maybe it's your providers and your clinical team that are the need. They need something to give for them to stick around. So by identifying concrete areas where your patients may benefit from remote monitoring, or like I said, your providers, that's how you gain buy-in. Your next steps are going to include forming a team. You're going to define your goals, and you're actually going to design the workflow. After that, and this is the critical step, you're going to develop or implement a platform to actually stay connected to their patients and enable that workflow between you two. So again, the AMA does say specifically, it recommends if you do outsource this, to try and find a vendor that's not just going to be a vendor, right? But a true long-term partner to your practice. So our recommendations to launch your own program really align with the AMA very closely. I kind of just made things a few less steps and expanded on them. But what we recommend is that after you have that identified need you need to focus on, the next step is going to be gaining that practice-wide program adoption and buy-in. This is going to include staff alignment about the initiation of RPM. You want to set very transparent goals and very clear expectations. So again, think of things like organization-wide communication. Think, if that's through staff meetings for your practice, if that's through, regular updates in any sort of communication tools you have, if that's a morning huddle, if that's a e-newsletter that goes out via email, however you can get the word out and get those goals and expectations sent out to gain that buy-in. The next step is going to be obvious, right? You need to build your RPM team. The success of any sort of RPM implementation depends on engaging the right people at your practice. So although one person can be accountable for driving the process forward, the process itself has to be a group effort. And while you won't need to directly engage all the teams right away, it is helpful to identify who will be on which teams and consider, when and how different players are going to be involved. So once you identify your key members, make sure to set regular meetings and outline the responsibilities clearly. And then your next step is to evaluate possible vendors across key criteria that will enable your goals. So again, this is assuming you're going to go the vendor route. You're going to need something, unless you're truly going to build it in-house, to get the technology and the devices and things in place. Our advice is to go into the process, again, with the intent of finding someone who will be a long-term partner and not just someone to execute a transaction with. This will involve some research, researching vendors from maybe other practices' recommendations. Maybe you're attending a healthcare conference and going to different booths, or maybe you even signed up for an informational webinar like this one. You never know. But you do want to try and evaluate web vendors across 6 key variables to find that best partner for you. And that's what we have on the screen. This again is taken from the American Medical Association, but it's spot on. So the 6 kind of aspects here that you want to judge your vendor on are going to be business, information technology, that the actual IT side of the house, usability, so what your patients will see from their perspective, clinical validation. Obviously, you want to make sure that these clinical outcomes are improving and this has been validated and is secure, which is our next one, security. Obviously, HIPAA compliance is huge in this area. And then also customer service. What kind of level of support are you going to receive as a practice from this vendor? And when you're ready, the next step is actually selecting that vendor and making your case. With this, you want to compile all the content you've gathered into a proposal. So this is going to include things like clearly defining the resources you need to move forward with this implementation, estimating that budget required to maybe obtain the resources to implement your program, things like vendor services, maybe equipment, maybe marketing, education for your staff and patients. This could be EHR integration and additional personnel resources if it's needed. And then with that, you're going to then estimate the value your solution will contribute to your practice if your RPM program is successful. So you want to calculate maybe the ROI of after the implementation, considering the budget and value you've estimated. But you also want to make sure that you're going to align your implementation of this program with your practice's objectives and goals to justify why this is a priority. And again, after you've done this, I would also include in this proposal, it's a good idea to research the coding and payment options available for remote patient monitoring. So what we just really touched on. The next step, again, once you've made your case, is going to be organization-wide knowledge of billing and reimbursement. So again, all those reimbursement specifics we just touched on, make sure your staff are aware of these billing codes as well as upper management so they know what to expect. And make sure, if your billing staff is available, your clinical staff is aware of these if they need to be, or at least be knowledgeable on what your partner or what your vendor is capable of and if they're taking that over completely and what to expect. And then comes the part of the rollout where patients get involved. So first is going to be patient identification, right? You're going to want to generate a patient list that would be good candidates for RPM, thinking of things like insurance, condition, maybe the preventative care or population health care that they receive. You may also want to consider a process for potentially flagging patients as RPM candidates when they have upcoming appointments. Next comes the actual patient onboarding or initial setup. At this step, it's crucial to set clear expectations with patients about what to expect with RPM, right? You want to consider, will your onboarding be remote or will it be on site? Or you don't even need to worry about this. Will your vendor handle all of this for you? I know some do, since we do actually. So looking at all the possibilities and patient impact is a huge consideration for rolling out this program. Next is going to be patient adherence. Again, likely your vendor would handle this as well, but if it is in-house, make sure your care plan is created and known by the patient, by the patient's caregivers, as well as your clinical staff. Again, you want to make sure there are clear patient expectations of daily readings and transmissions or whatever they need to comply with as well. And then last but not least is going to be patient engagement. If this is in-house, or even if not, but to make sure to provide sufficient time for staff to devote to RPM. If you're partnering with a vendor, try and take full advantage of RPM for increased staff productivity and addressing burnout. But still, make sure that you follow up with patients. Make sure they're having a good experience with this. I do suppose, though, if they are having a bad one, I'm sure you'd be the first to know. But if you aren't hearing from them, take that opportunity to engage the patient and reach out, maybe sending a survey out to your RPM patients and seeing what their experience has been like. And if it is positive, then using that data to your practice's benefit and knowing that. Now, if you are feeling overwhelmed, with the idea of rolling this out on your own, DAS Health does offer a complete turnkey RPM solution, and it's available right now. And I mean turnkey. Everything is handled in a very seamless and straightforward manner to make your life easier while serving your patients. So I'm going to turn it back over to truly our RPM expert here, Melissa, to really explain what the solution looks like and how it works. So Melissa, it is all yours.
Well, thank you, Lindsay. So strategizing to incorporate your own RPM solution really does not have to be tricky. And that's where we can assist. DAS makes this very easy for you and your patients. What you'll see here is going to discuss the key factors that you should consider when you incorporate an RPM solution into your practice and how we can help with that. So patient engagement, I think, is probably one, if not the most important, is the device needs to be simple. It needs to be easy to use by all patients. The communication tool needs to be built in and set up similar to a mobile device or like a mobile device. It needs to also be ease of use. The automation, communication, interoperability with the EHR, et cetera. We need to make sure everyone from the staff to the physician to the patient is able to see the data, understand the data, that the patient is, it's very easy for the patient to use the device and transmit that data and even to communicate with their care coordinator. Customer support. So we provide that ongoing support always for your staff, for your patients, and we will always assist with any and all questions. And I'm sure, as you all know, CMS is famous for changing things and change mid-year. All of a sudden a code changes or a price changes, something's going to change, and by the way, guess what? They don't notify you. So one of the things we do is we track all of those changes. I know that CMS can be very vague sometimes. Some of their rules and guidelines aren't always easily interpreted. As a partner with DAS, we are going to track those CPT guidelines, and we're going to keep up to date on any rules or regulatory changes and communication with you and your staff when we do see those changes. Similarly, when price increased for chronic care management, we were able to see that prior to the final rule coming out, and it was in their CMS 11 up on the virtual care services and notifying the clients right away that that increase would happen. So being a partner with DAS does come with those types of benefits. And why should you choose DAS as your health solution? Well, we want to help improve your patient care. We want to reduce the hospitalization, the in-office visits, and increase the revenue. Not only do we feel it be important to show value to your practice, but we want to show how valuable this program is to your patients. We want to strengthen the relationship between the clinician and the patient, and we are going to constantly monitor and work with your patients so they provide the data and accuracy from that data to you in real time. Why choose again DAS? One of the things when I researched remote patient monitoring, and some of the things that I found to be a little bit tricky for the practices was the procurement and delivery of the devices. The devices that we have are drop shipped directly to the patient. They're delivered in 2 days, and we track all devices to assist with the setup once it is received by the patient. We are going to constantly monitor to make sure the patient sends that data. There is zero upfront cost to the practice. We're going to provide training, implementation, and all the resources that you need. And of course, compliance is extremely important. So some of the next, oh, I'm sorry, Lindsay, I was going to have you. So some of the information on the RPM that we see patients is, you can see where they feel there's convenience, where they feel it's effective, the control over personal health, their greater accuracy, and peace of mind. This is some of the data that we did find and were able to collect from our patients. Next slide. So how it works. DAS will create and run reports within your EHR so we know which patients are eligible for the RPM services. We're going to work with you to approve the patients that are going to be enrolled and begin the outreach to them. So once we've created these reports for you, we're going to send them to you. We're going to work with you to make sure that you understand which patients are eligible and that we have your approval to reach out to them. We're going to educate each patient on the service being provided and how the devices are set up and work. Once the patient has accepted the program, we're going to drop ship those devices directly to the patient's home. We track each device with a 2-day shipping so we know when they arrive, and we contact the patients to assist them with the setup and use. We're going to reach out daily to ensure the patients continually monitor their condition and utilize the device to track their data. Our care coordinators are also going to work with the patients to prepare their care plans, and they're available for any questions, any concerns, any issues. Should there be a problem with the device or with the monitoring, looks like kind of a beeper, we'll show you that in a second. You send those directly back, the patient sends that directly back to us, and we will drop ship them a new device. There is absolutely no reason for the devices to be sent to the practice or for you to procure your own device. We take that burden directly off of the practice. When you do start billing for these services, we're going to work with you and explain which patient can bill, you can bill for which CPT code. Obviously, we had already discussed this previously. However, we're going to monitor every single solitary patient that delivers 16 days We're going to let you know which CPT codes can be utilized, which diagnosis you will utilize for the CPT codes. If we go over that 20 minutes of service, we're going to let you know to bill 99457 and 99458 when billing for the care plans. We will send you a list of patients on a monthly basis that shows every single solitary CPT code that you can bill for each individual patient. Some of the benefits that you're going to see from utilizing DAS is the enhanced monitoring and coordination between office visits. So we're that visit in between visits. You're going to get that data real time. We upload everything directly into your EHR for you. So there's no separate software that you need to look at when you're reviewing the patient's data. It's, like I said, real time, but we're also going to send you 60 days of data. So you're able to track and trend where improvements need to be made or medication may need to be changed for a patient. We're also going to make sure that the patients stay on track and that they are engaged in their care. Sometimes when a patient comes in, maybe you're monitoring them for their blood pressure, hypertension, and they bring their book of recorded blood pressures. And then you take their blood pressure in the office and it's completely different than any of the recordings that they had. The data we are delivering with the patient to make sure that they are doing this accurately is, again, in real time. This is in turn to make sure there are superior outcomes for your patients, that the patient continues to have the accountability, and that we're going to help increase that relationship with you. All, by the way, with helping you generate some additional revenue. The patient benefits is they're going to have access to a dedicated care coordinator. When we assign a care team or a care coordinator to a practice, we keep that care coordinator with that practice and those patients. That helps develop trust. That helps the care team become familiar with the patient's needs. And we also are going to help them meet their goals that they've either set with the practice or for themselves. There's going to be constant interaction. They're going to have a greater care over their own personal health. We're going to work with them to encourage them to not only follow their own goals, but to follow the care plan that you have created for them. Remote patient monitoring helps identify any changes in the patient's health. There is improved health and financial savings, and of course, they're able to use the device anywhere, whether on vacation or in their home. Just give you an idea of what the devices look like here. This, like I said, looks like a teeny little beeper. There is no Wi-Fi required to connect to. The device captures the data, allows the patients to directly communicate with the care team because this device is utilized over an AT&T network. So they literally can use this device as a phone, communicating directly with the practice or with the care team. The next slide you'll see is what the reports look like. I know this is small. We'll make sure if anybody wants to see a sample of device readings, we can send that. But these readings are sent in real time. If a reading is going to be out of range, an email is sent directly to the clinic as well as to the care coordinator. So you let us know who wants to be notified when a patient's reading is out of range. We're also going to send data for previous 60 days so that you have that comparison. All reports are going to be directly uploaded into your patient's chart. Again, no need to look anywhere else for any of that information. And that's truly everything we have for remote patient monitoring. We make it simple, we make it concise, we make it easy for the practice. So Lindsay, I will turn it back to you.
Great, thank you, Melissa. So if anyone on this call is interested in learning more specifically about the DAS Health RPM solution, Right now, feel free to reach out to your DAS account manager for more information. They will have more information ready, but they're also going to be able to reach out to us as well to provide additional details, but also potentially, schedule some time with Melissa or I for a really in-depth overview, answer your practice-specific questions, or even a demonstration of this service. So first step is going to be account managers, and then we would likely talk soon. With that, if you have any other questions, or you can reach out to us with our contact information on the screen. Those are our email and direct lines as well. So feel free. I do know we have some questions that were coming through the chat during this time as well that I will default to Chelsea if she'll go ahead and read some of those out loud, and we'll do our best to answer them, live time here. But if you think of anything else after the webinar as well, like I said, our contact information is on the screen.
Great, thank you so much, Lindsay. And again, thank you everybody for joining us today, and thank you, Melissa. We're going to go through the questions in the order that we received them. There's only a handful, so we still got plenty of time left. So if you have any, feel free to shoot them out, and we're just gonna go through them all. First one, what are examples of how it can be used for mental health diagnoses? Lindsay, do you wanna take that?
Yes, I can. I actually did some research into this because if you're like me, which obviously you are, you saw that and you second guess, wait a minute, how, mental health illness, how is that going to manifest in a physical symptom? Which it's true. They've had a lot of studies recently that you can actually remotely monitor patients and almost prevent severe episodes of mental illness by looking at a few kind of key areas here. So one of the ones that they pointed out was taking advantage of a SMART scale. It's been known that substantial weight loss or weight gain are often associated with depression. So some sort of extreme change in eating habits could signal, an episode coming on. Along those same lines, a heart rate monitor. Think excessive fear or depression or anxiety may affect a person's natural heart rate. A lot of times we see an increase in that heart rate or even potentially a heart palpitation. So that's one of them. Another one that I saw come up a lot, which, I think we'd all think of is potentially a sleep tracker. Think your Apple Watch you can sleep with that on, and it'll track your sleeping habits. Same thing. I think we all know that with mental illness, sometimes insomnia can be caused by sadness or worry or some sort of psychological stress. That you wake up during the night, or you can't get to sleep, or you're waking up very early. So kind of a change in that sleep behavior could relate to a significant change coming or a mental illness bout on the horizon. So those are just 3 examples. I know there were some other ones out there as well that we could look at, but those were the 3 top ones that really occurred to me when I was making this presentation.
Great, thank you, Lindsay. Next question, Melissa, maybe you can answer this one. How are we going to know what to bill for?
So every single solitary month, we will send each of the practices a list of their patients, and the patients will also have a list of CPT codes. So whatever codes are billable for each patient, we're going to notify you. We'll have it all in a pretty little Excel spreadsheet, so you will know every single month who you can bill for and which codes to bill.
Great, thanks, Melissa. Next question. I came in halfway. Can I get a video of this again? Absolutely, I'll answer that one. I'll be sending out a copy of the slides along with the recording within the next few days here, so just check your email for that, and we'd be happy to pass that along to everybody who registered for this.
Was that fun, teeing yourself up?
Yes, I actually did. I did enjoy answering a question for a change.
Yes.
So it looks like this might be our last question, but we'll also hang on for a few more minutes just in case anybody's in the middle of typing here. Can you explain again how the devices are delivered to the patients if we go with the DAS thing? Melissa, do you want to grab that one?
Sure. Very easily. What we do is once we know that a patient has accepted the program, because we're going to enroll them for you, we're going to take all that burden off of the practice, we're going to directly ship the devices to the patient. We track them, we send them second day air, excuse me, so that then we track them so we know exactly when the devices are delivered. We then contact the patients and walk them through the setup and delivery of data. So we're going to set up the device with them over the phone, and we're going to have them deliver their first set of data to us. So all that burden is taken off the practice. You let us know which device you want this patient to have. We drop ship it directly to the practice. Bada bing, bada boom, it's done. And the practice does not need to worry about procuring devices or doing anything else with them.
Okay, and it looks like we have a great kind of follow-up question that came in as you were answering this one as well. What happens if the devices are not returned?
We cross that bridge when we come to it. I have to be honest with you, we have not had that issue before. Obviously, if a patient does not return a device, we would work with the practice as to how they best want to handle that. Like I said, it hasn't really happened before, so it is a great question. It's a question that's always on our mind, but we walk through with the practice what they would like to do.
Okay, great. And looks like this is our last question here. If we were to go through DAS for this service, what is the effort required on our staff and providers? I'm sorry, time effort required on our staff and providers?
So I'll take that to minimal, very, very little. That's part of the beauty of using a partner to work with your patients for remote patient monitoring. We try to make this as simple as possible. The idea behind it is to truly take that staff burden off of your practice. The most time needed would be probably reviewing the list of patients that we find eligible and us reviewing that with us to determine which devices that you would want the patient to have. That's not a requirement. It's just probably the most effort that would take. It's very, very minimal. I hope that answers the question.
Okay, and it looks like we did get another one in. What is the cost to use DAS for RPM?
And I can jump in here. Yeah, I was going to say that. I was just going to say that is a great question to start the conversation with your DAS account manager. They are going to have all the details on pricing, just because specific to certain practices and not knowing exactly who asked and details along those lines. That's a great lead-in question if you are interested in a solution to reach out to your account manager about, and they can get you all the details and more on that.
Okay, perfect. Well, again, thank you everybody for joining us. We're looking forward to presenting more of these educational webinars coming up here in the future. So we hope to see you on those, and have a great rest of your week. And I'll be sending out these slides and recording soon here. Thanks for joining us.
Yes, thank you everyone. Have a great day.
Thank you, everyone.